You just turned 65. Medicare Part B covers 80% of your doctor bills, but you're on the hook for the other 20%. One hospital stay? That's $1,676 out of your pocket before Medicare pays a dime. Over the next year, those gaps could cost you $5,000, $10,000, maybe more. But here's what nobody tells you. Picking the wrong Medicare Supplement plan could mean you're paying $500 more every year for coverage you don't actually need. In the next 10 minutes, I'm going to show you exactly which Medigap plan puts the most money back in your pocket in 2025. Here's why this is so confusing. Original Medicare, that's Part A and Part B, leaves holes in your coverage. Big holes. You pay the part of the deductible when you go to the hospital. You pay 20% of every doctor bill under Part B. You pay co-insurance for skilled nursing. It adds up fast. That's where Medicare Supplement plans come in. Some people call them Medigap plans. Same thing. These are private insurance policies that fill those gaps. They pay what Medicare doesn't. Now here's where it gets tricky. There are 10 different letter plans. A, B, C, D, F, G, K, L, M, N. Every plan G is identical no matter which company sells it. Every plan N is the same. The benefits are standardized by the federal government. The only things that change, the price and which company you're buying from. Most people turning 65 today are choosing between two plans, Plan G and Plan N. These two plans account for about 80% of all Medigap policies sold. Why? Because they offer the best balance of coverage and cost. That's what we're diving into today. Which one makes sense for you? Let's start with Plan G, the most comprehensive plan you can buy if you're turning 65 today. Plan G covers almost everything Medicare doesn't. I mean everything. Hospital deductibles? Covered. The 20% co-insurance on doctor visits? Covered. Skilled nursing co-insurance? Covered. Even emergency care when you travel outside the U.S. Up to 80% covered. The only cost Plan G doesn't cover is the Medicare Part B deductible, which is $257 in 2025. That's it. You pay that once per year, and then Plan G picks up 100% of your Medicare-approved costs for the rest of the year. Here's what that looks like in real life. Let's say you're Sarah. She's 65, lives in Atlanta, and just signed up for Plan G. Her premium? About $130 per month. That's $1,560 per year. Plus she pays that $257 deductible at the start of the year. Her total predictable cost for the year? $1,817. Now Sarah needs hip surgery in March. The hospital bill is $45,000. Medicare Part A pays most of it, but there's that $1,676 part of deductible. Plan G covers it. She pays $0. Then there are follow-up visits with the orthopedic surgeon. Physical therapy twice a week for 3 months. Medicare Part B covers 80%. The bills come to $8,000. Sarah's 20% share will be $1,600. Plan G covers it. She pays $0. That's the beauty of Plan G. Once you paid your monthly premium and that Part B deductible, you know exactly what your healthcare costs will be. 0 surprises. 0 copays when you see the doctor. 0 coinsurance. Nothing. If this is making sense so far, hit that subscribe button. We break down complicated benefit rules like this every single week. Still with me? Good. Because here's where people start wondering if they can save money with Plan N. Plan N is Plan G's more affordable cousin. Lower monthly premiums, but you pay a little bit out of pocket when you use it. Plan N covers a part of deductible co-insurance, skilled nursing, blood transfusions, foreign travel emergency care. All the same stuff as Plan G. But here's what's different. You pay up to $20 copays for doctor office visits and up to $50 copays for emergency room visits. You also don't get coverage for Part B excess charges. What's that? It's when a doctor charges more than Medicare's approved amount. They can charge up to 15% more. Now, most doctors don't do this. Only about 1% nationwide. But it's a risk. Let's go back to Sarah. But this time she chooses Plan N instead. Same city, same age. Her Plan N premium? About $90 per month. That's $1,080 per year. $480 less than Plan G. But remember, she's got those copays now. She sees her primary doctor 4 times a year. That's $80 in copays. She has hip surgery, so add 3 visits to the orthopedic surgeon, $60 more. Physical therapy twice a week for 12 weeks? That's 24 visits at $20 each, $480. Her total out-of-pocket for the year? About $1,877. Wait a minute. Plan N costs her $60 more than Plan G, even with the lower premium. Why? Because she had surgery and a lot of follow-up care. But here's the thing. Sarah's situation isn't everyone's situation. If you're pretty healthy and only see your doctor a few times a year, the math changes completely. Let's say you're Tom. He's 65, same city, also choosing between Plan G and Plan N. Tom sees his doctor twice a year for checkups, and that's it. No surgeries, no specialists, no emergency room visits. With Plan N, Tom pays $1,080 in premiums plus $40 in copays. Total, $1,120 for the year. With Plan G, he pays $1,560 in premiums. That's it. Tom saves $440 with Plan N because he's not using a ton of healthcare services. Here's my rule of thumb. Take the difference between your Plan G premium and your Plan N premium. Divide that by $20, the office visit copay. That tells you how many doctor visits per month you'd need before Plan G becomes a better deal. Now, let's talk about what really matters. Which companies offer the best rates and service in 2025? Remember, all Plan Gs are identical. All Plan Ns are identical. So, you're shopping on price and company reputation. The top Medicare Supplement companies for 2025 include AARP/United Healthcare, Mutual of Omaha, State Farm, Anthem, and Humana. These companies stood out for their low complaint rates, competitive premiums, and financial stability. Here's what you need to know. Prices vary wildly by location and age. A 65-year-old in Florida might pay $150 for Plan G, while the same plan costs $110 in Arizona. You got to get quotes for your specific zip code. Also, most Medigap policies use what's called attained age pricing. That means your premium goes up as you get older. A 65-year-old might pay $130 for Plan G, but at 75, that same person might be paying $180. It's not because your coverage changed, it's because you aged. Some companies offer household discounts if you and your spouse both buy policies. Some give you a discount for paying annually instead of monthly. Some even give you a break for enrolling online. Here's what you absolutely must do. Shop around. Get quotes from at least 3 companies. Don't just take the first price you see. We're talking about a policy you might keep for 20 or 30 years. A few hours of comparison shopping could save you thousands. One more thing, timing matters. You have a 6-month Medigap open enrollment period that starts the first month you have Medicare Part B and you're 65 or older. During this window, insurance companies can't turn you down or charge you more because of health problems. Miss this window, and you might face medical underwriting. They can deny you or jack up your rates based on your health. Drop a comment and let me know. Are you leaning toward Plan G or Plan N? I read every single one. Let's talk about the 3 biggest mistakes I see people make with Medicare Supplement plans and how to avoid them. Mistake number 1, buying Plan F if you're new to Medicare. Plan F isn't available if you turn 65 on or after January 1st, 2020. I still get calls from people asking about it because their friend has it. If you became eligible for Medicare before 2020, you can still buy Plan F. If not, it's off the table. Don't waste time looking for it. Mistake number 2, thinking Plan N will definitely save you money. Plan N has lower premiums. Yes, but if you see the doctor a lot, and I mean a lot, those $20 copays add up fast. Do the math first. Add up your expected doctor visits a year. Multiply by $20, then add your Plan N premium. Compare that to your Plan G premium. The answer might surprise you. Mistake number 3, missing your Medigap open enrollment window. This is the big one. You get 6 months starting when you turn 65 and enroll in Part B. During this time, guaranteed issue, no medical questions, no denials. After that window closes, insurance companies can say no. They can charge you more. They can exclude coverage for pre-existing conditions. I've seen people try to buy Medigap 2 years after turning 65 and get turned down because of diabetes or heart disease. Don't let that be you. Here's exactly what you need to do. First, check your Medigap open enrollment deadline. If you're turning 65 soon or just enrolled in Part B, mark your calendar 6 months out. That's your deadline. Don't miss it. Second, get quotes for both Plan G and Plan N from at least 3 companies. Use Medicare's Plan Finder tool at Medicare.gov or call the State Health Insurance Assistance Program. That's shipped at your state's number. They're free, they're unbiased, and they'll pull real quotes for you. Write down the premiums for each plan and each company. Third, do the break-even calculation. Take the difference between Plan G and Plan N premiums. Think honestly about how often you see the doctor. If you're there once a month or more, Plan G probably makes sense. If you go twice a year for checkups, Plan N might save you money. Fourth, check if your doctors accept Medicare assignment. Plan N doesn't cover Part B excess charges, which means you could be responsible for an additional 15%. If you see a provider who charges more than the Medicare-approved amount, call your doctor's office and ask, "Do you accept Medicare assignment?" If they say yes, you're good. If they say no, stick with Plan G. Finally, enroll during your open enrollment period. Not next month. Not when you get around to it. Now, mark it down, set a reminder, and get it done. Here's the bottom line. Plan G remains the most popular and comprehensive Medigap option for new Medicare enrollees in 2026. It covers almost everything, gives you total cost predictability, and eliminates surprise medical bills. Plan N saves you money on premiums, but only if you don't see the doctor often. For most people watching this, especially if you're turning 65 soon, Plan G is the safe bet. It's comprehensive, it's predictable, and it's worth the extra $30 or $40 a month for peace of mind. But here's the thing most people don't realize. You're not stuck forever. If you buy Plan G now and decide 3 years from now that you're healthy and want to switch to Plan N to save money, you can apply, though you'll face medical underwriting at that point. Don't leave money on the table. Don't miss your enrollment window. And don't pay for coverage you don't need. Next up, I'm breaking down the biggest Medicare Advantage mistakes that could cost you thousands. You don't want to miss it. I'll see you in that video. Now, I could sit here and tell you to like and subscribe, but let's be real. You're only going to do that if this video actually helped you. And here's the truth. Most people watch this entire video, learn exactly what they need to know, and then disappear without subscribing. They'll Google the same question again in 6 months, waste another 30 minutes watching 5 different videos with conflicting advice, and still be confused. But you're smarter than that. You know that Medicare is complicated, that the rules change every year, and that having someone who breaks this stuff down in plain English is worth clicking one button. So here's my challenge. If this video saved you from making a $5,000 mistake, from choosing the wrong plan, or from missing your enrollment deadline, hit that subscribe button right now. Because next month when Medicare sends you another confusing letter, you'll want to know where to come for a straight answer. And if you found this helpful, share it with one person who's drowning in Medicare confusion right now. They'll thank you for it.